Yeah, you should have worn a jacket today. You're just pretty late for this weather. You're just a little bit too unprepared for this weather.
But I just need my brain is just fried.
Oh, no.
Because you stand there and then they ask you, okay, what is this million? What is that? What are you doing this?
Everything you're getting to.
The students, like how well you guys are doing, everything is monitored. Like this chance is really good. He's a musician, but he loves wine. Pretty much, he's the best. He said we're the best in this whole thing. I know, but yeah, but when you're there, remember I tell you guys about stress? Like when we were done, all of a sudden I felt like my body, seriously, like, and then I realized it was all stressful. Yeah. It's amazing, but I went when it was a rainy day and it was not cloudy. Oh, it was great because then the dragons. I love that. It's Voldemort's everywhere. Okay, guys, we put it back. Okay, we'll finish up today, and again, you guys have been really very responsive. I like it. Thank you for the little. Thank you for the stuff you sent online. Not the case of anti-gin, but I really appreciate all that. So anyway, we'll finish up with drugs of abuse. We'll go through the cases today. It's a lot of material. Muriel, don't hit yourself. It's not a good thing. We'll go through the different cases and we'll pick out the key elements that you should know, for the future. Okay, and I think the last thing we talked about was mules or body packers. And I had explained to you that, when you're dealing with one of these individuals, clearly these are folks that are transporting internally very highly concentrated product. And if there is ever an incident of some sort, you're dealing usually with a significant heroin overdose or a significant cocaine overdose. The easier one to manage is the significant heroin overdose. The other issue with a significant cocaine overdose is if any of the packets, they're usually condoms that are tied up, and if they break, in a lot of situations it becomes a surgical emergency where you just have to cut the patient open and remove the contents surgically. So again, that's a significant issue. We'll talk about one of the cases is a body packer case. One of the key indicators is if somebody is a body packer that they come to your institution, one of the things you do not give them is mineral oil as a laxative, because the mineral oil will dissolve the condom and you will precipitate release of the contents. Okay. The next thing I want to talk about is phencyclidine, or PCP. That is also on your handout called angel dust, peace pill, hog, Sherman. The reason why they call it hog, it's an animal. This drug is used as an animal anesthetic. Shermans are cigarettes, and the Sherman is a cigarette that is dipped in PCP. And Sherman is, the reason why they got that name is there was a tobacconist in New York called Matt Sherman, and they make these designer boutique kind of cigarettes and boutique kind of cigars. The other names, interesting, just so you can see how it has evolved. Killer weed, dust, for angel dust, surfer, or rocket fuel. So clearly this is not a nice sort of sedative kind of drug if they call it rocket fuel. It can mess you up. Okay, so again, this was synthesized in the late 20s. Originally it was used as an anesthetic and an analgesic, but then the side effects were manifested. It was used as an anesthetic and an analgesic, but then the side effects were shown. The adverse events that were found were that after the anesthesia, the patient had hallucinations, got agitated, and had seizures. So its use was stopped. It was popular again in the early 70s. In San Francisco. And some people like it, but the side effect profile, as you'll see, is unfavorable. So it is not used deliberately by a lot of individuals, although some people like the one component of the event. It is easily titrated and it's easily made. So when people inhale this, if you are into this, you can kind of predict how you're going to react to it. If you like it, okay, if you like it. I'm going to keep saying that because this drug is used as an adulterant in other drugs. It's active orally, by inhalation, intravenously. A popular product on the street is called ketamine. What is the street name for ketamine? Special K. And as I said, it's used as an adulterant for crappy drugs. 80% of first-time users have a pleasurable effect. So what are the effects? Well, the effects start almost immediately and they last about 4 to 6 hours. Now, I'm going to go through these and I can actually describe some of these to you. Actually act them out for you. First is sensory isolation. This drug is a dissociative anesthetic. So basically, what it causes is something called a dreamy estrangement. You essentially have an out-of-body experience. And some of the overdoses, when they are calm, they will, it's called coma with eyes open. They'll be there and they'll be, you try to wake them up and they'll be like, Creepy, right? Now you do that for like a half an hour, and the problem is that this stuff undergoes enterohepatic recycling. So again, it's an animal anesthetic. Now, essentially, the sedation that occurs because it is an anesthetic, and you're kind of under, but then it also alternates with violent mood swings. It causes disequilibrium and altered perception. So, for example, like these guys are typing, so like I'm in the clinic and they're typing. What I might hear is boom, 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 boom. You know, it just alters your perception, and or like she sneezed, and all of a sudden I'll hear like something, you know, totally different. And then it causes paranoia because you get auditory hallucinations as well, and image distortion. So, for example, if you want to intubate somebody with this poison, you'll approach them and they'll think you might be trying to use a spear on them, or you're trying to, you know, kill them, or something like that. But they become very violent and they become very strong. And some people get a feeling of impending doom. Again, a real fun drug. The reason why some folks get really crazy is, and we'll talk about it in a little bit, but they will essentially have this depersonalization experience. So they will feel that their soul, for those of you who believe that we all have a soul or your essence, like you're here, and then all of a sudden your essence is like where they are, watching me, watching me, watch me. Some people get totally effed up because if you have a psychological, I mean, most people, like if you're here and all of a sudden you can't move, right? Because you're anesthetized. And when you're anesthetized, do you feel anything? No. So you're here. You know you're here. You can't feel you're here. Because, like, I would not be able to feel that I am sitting on anything. And yet, then I will see myself there, my soul there, looking at me. But is it me? Am I there? And some people, he's laughing, wait till they start chasing you, though, around the gurney, trying to kill you. It can, in some individuals, cause a psychiatric crisis. I mean, most of us would probably feel very strange if we had a depersonalization effect. But some individuals, they just get crazy. Yes?
You mentioned that 80% of people the first time they try it actually have a good experience?
They like it. Some people like it. And that is, and again, some individuals, like I said, that happens to some people. Some individuals, if they're just there and they feel like they're in a coma or like a dream state, you know, they're totally fine with it. They actually like the feeling.
So it's just the way they react.
It's the way they react. And you'll see in a few minutes, how you react depends a lot on you, yourself, and then also your environment. Okay, so, some individuals like to add PCP to a hallucinogen and cocaine. And the hallucinogen sometimes is LSD or mescaline. So here you have combining a drug that causes altered perceptions with a drug that causes hallucinations. Plus, let's throttle it all up a little bit with a healthy dose of cocaine. The clinical picture, a blank stare, again, like you're in a coma, nystagmus, then yes?
So would you say a depersonalization effect of substances essentially goes into the
Some individuals will actually have an out-of-body experience. Nystagmus, vertical and horizontal. If the individual is coherent and you're doing a visual field check, if you have vertical and horizontal nystagmus, you try to restrain the patient if possible and get out of the room. Because what happens with this drug is they will become very calm and then they will become very, very agitated, and they're also very strong. Variable manifestations are just like that. You have to be very careful for yourself from a safety point of view. Typically, like if they would bring in somebody who is fairly slight in terms of their size, and they have just had an altercation with NYPD, like throwing 4 or 5 cops around, and they're really tiny, you know something is going on. Or like they jump through a plate glass window or something like that. They're usually very strong. There have been stories where some of these folks have actually broken handcuffs because they don't feel the pain. Now that doesn't mean that they don't get damage. I mean, they essentially cause significant damage to themselves and also to the people around them. To her point about how does this happen, some individuals, depending on the dose, the route, something else that's in it, their personality, their tolerance to it, it will actually, the interesting thing about this drug is that your personality may affect how you react to it. Also the environment that you're in. If you're in a loud environment, if you're in a noisy environment, if you're in a soft environment, a comfortable environment, if you're with your friends, you might react differently. From a clinical point of view, these individuals usually come in because they're acting erratically. Psychotomimetic effects. This means that they do not interpret accurately what they hear or see. So again, if you try to intubate the individual or put down a lavage tube, they will think you might be attacking them with a spear or a snake or something like that. If you say, "Are you okay? Are you okay?" they might hear, "Are you okay? Are you okay?" Again, because the perception is totally messed up. They will not be restrained by pain, and that's because they have a lot of strength and power, and they have auditory hallucinations. They can hear things telling them to do stuff. You will get gruesome injuries. We had we did a nice review article a few years ago about this stuff. We had one case where somebody was smoking marijuana that was laced with PCP. He had auditory hallucinations that said that his hand had offended him, and he needed to chew his hand off. And he started to do that, and essentially got halfway through, looked at it, and realized that it did not look right. And then showed one of his friends, and they took him to the hospital. Why was he able to chew through his own hand? He didn't feel the pain. That's why that was a weird injury. We had one case that we actually saw. It was at Radio City Music Hall. The person was listening to a concert. It was in, how many of you guys have been to Radio City? Okay, so you see how the balconies are scalloped? Like you've got one balcony. So he was there, and it was a rock concert, and somehow he heard the music calling him, "Fly to me, fly to me." So he actually got up, walked down the aisle, and then just jumped and did one of these, and landed here, like this, on the orchestra level, like this. Totally shattered his jaw. And it was like, what's going on? What's going on? And so he was brought in. He probably was saved because he felt no pain. He felt no pain due to the impact. So that kind of stuff, you know as PCP, yeah.
So because these patients get so violent, are they allowed to refuse help, or do they
Good point. If these patients are so violent, are they allowed to refuse help? The answer is no, because they have hurt themselves and they can hurt you. So those individuals, you can restrain them for their own safety and for your safety. Good point. Because clearly they're not rational. So, and they also get this PCP psychosis, as we mentioned. So how do you treat them? Well, you've got to stabilize them. If they come in a coma, they get? Yes, they get naloxone. If they are having respiratory difficulty, you intubate them. If they are seizing, you give them a benzodiazepine. Enhancing the elimination, I have a question mark there. Now, from a pharmacologic point of view, you know what, as some of you said, oh, in another class they taught us that this drug is enterohepatically recycled, okay? It also has a significant volume of distribution. You cannot enhance the elimination of this drug. You can try, but because it is enterohepatically recycled, you can suction whatever is in the stomach. What's going to happen once you're done suctioning? It will redistribute right out. Okay? So, enhancing the elimination is a question mark. If they are hyperthermic, you cool them off using ice age technology, cooling blankets, or a refrigerator blanket. If they're agitated, you give them diazepam, or if they're really psychotic, we give them that thing called vitamin H. It's not a real vitamin. H is for Halo. Yeah, please do not tell your other faculty that haloperidol is a vitamin. It is not. But somebody say, hey, let's just give her a dose of vitamin H. That's code for Haldol, or a benzodiazepine. Decrease sensory input. Do not talk these people down. Because if I say, are you okay? How you doing? Okay. She might hear who knows what, or I might appear to be a monster. These people, because they're so violent, usually get restrained. But when the drug is recycled, they will give you, when the drug is in the GI tract, they will give you the sweetest, he's hurt. Why are you hurting me? Can you untie me, please? You look like a nice, what do you mean, no? He's hurt. Really, come on. I'm pleading. Will you untie me, please? Why are you laughing at me? You make me feel bad. Get nervous, right? Imagine alone in a room with a patient like that, and they're like this close. See, it's good. And the worst thing you can do is untie them, because then all of a sudden, when the drug gets back into the systemic circulation, you may appear to be a monster, and they will try to hurt you. Yes? That is an excellent point. When do you know it is safe? One of the, again, this is not, and please do not tell Dr. Minko, this is based on Verono-kinetics. If they cycle 4 or 5 times, they will get calmer and calmer. After about 4 or 5 cycles of agitation, calmness, because the stuff will last 4 to 8 hours, so like 5 half-life-y kind of things, toxico-kinetic-y things. Frankly, we never, until we discharged them, they were always in soft restraints. And again, all kidding aside, these restraints are not, they have lamb's wool, they're leather. You're not, harming the patient, you're just protecting the patient. We had one situation where the guy got so violent, he actually tipped the gurney over and hit his head. And there's nothing you can do, for that. So that's a very good question. So what we would do is we would just close the lights, restrain them, make sure that their vitals were fairly stable, and then close the lights and let them relax. Yes, sir?
Can you give them activated charcoal, or will it not bind to activated charcoal?
It will bind to activated charcoal, but it's really, I mean, this is pretty much a presumptive diagnosis. I mean, trying to getting to drink activated charcoal is very difficult. Putting an NG tube down is a real pain in the butt. So, you know, you just let it go. I hate to say that, yeah. If they're psychotic, you give them Haldol. And for rhabdomyolysis, this drug, because of the muscle damage, you have to make sure that they are hydrated. You have to start an IV because you want to protect the kidneys. These individuals will have rhabdomyolysis, which is breakdown of muscle fiber. Okay? All right. One other case one of the concerns with this particular drug is because of the fact that it is used to adulterate lower quality drugs. There was a case a few years back where 4 kids on the Grand Concourse in New York smoked some marijuana that was laced with PCP. They got real psychotic, and I think 1 or 2 of them got killed because they ran out onto the Grand Concourse. How many of you have been up around Yankee Stadium? See the Grand Concourse, it's like 6 lanes down, 6 cars everywhere. They just ran out and they were killed because they were just psychotic and they ran out into traffic. So again, it's really, if you like it, it's different, but a lot of times it shows up as an adulterant. And I think that is one of the major causes of a lot of the fatalities that you see. Okay. Let's talk about LSD. Is that next? Okay. LSD is an interesting drug. There's a lot of information here. I'll tell you what is necessary to know. It is a naturally occurring product, lysergic acid. It is found in various fungi and in seeds. It is used to study some mental possibilities. This guy, Dr. Hoffman, in 1938, he tried it, and I love this. He swore that he inadvertently ingested it. Sort of like he accidentally ingested it several times. And he thought it had a psychoactive effect, like intense light and color images. In the 50s, it was investigated as a compound to alter personality and alter behaviors that they are listed. Various governments use this drug as an interrogation tool. They use it as an interrogation tool. People loved it in the 60s. The 60s. People loved it in the 60s, then it stopped, and now it's back. It is very popular in the suburbs. And a lot of times you will have a very pleasurable effect, but you can also have something called a bad trip. The next piece of it, I'm not going to test you on. From mechanism all the way to pharmacokinetics. Okay? Because again, this is not a toxicokinetics course, but it's not a toxicokinetics course. Folks will like to use it though. There's blotter acid, or it's called like the window pane or blotter acid. It's in the case that we talk about, and people will just ingest it and they'll get high. Now, the psychotropic effect, the reason why this drug is sometimes used as mind control is because it actually causes behavioral changes. Are you up to psychotropic effects? Again, we did a review of this drug, and one of the concerns is that it can alter in some individuals their personality. Sort of like she asked earlier about the PCP. A lot of how you react is based on your personality. Well, this drug, in some cases, can actually flip a switch or neurologically alter your personality. Okay? It doesn't happen all the time, but sometimes it does. Now, this is what it can do to show you how visceral this drug is. It can make cats afraid of mice in an experimental situation. Now, cats always chase mice. What was that cartoon? Tom and Jerry, right? So now, can you ever imagine, like, who was the cat? Tom? Right. Okay. Wow, it was Tom. Oh. Now, can you imagine if the mouse all of a sudden scared the cat? I mean, this is like a primitive, hardwired activity. Spiders, and some of you are going to look it up. You don't have to send it to me, but like you've seen a spider web. It's a beautiful architectural design. Spider webs with LSD spiders, like they have them drink LSD. Like I said, got really small mouths, so they don't like do blotter acid, but they put it, they put it in their little water. Like they spin the web like they don't care. Like it's usually a glob or a totally mismatched. Like you can tell, it's like, hey, what a crappy web. It's because the spider doesn't care, And again, spiders spinning webs is a hardwired genetic ability. Fish, like how do fish swim? They swim like this. When they put LSD in the tank, the fish are like swimming upright, like really, like a conga line, like in The Little Mermaid, like those fish are all on LSD because they're kind of dancing and swimming upright. Now, fish don't do that. So can you imagine what it'll do to your brain in terms of your activity? From a recreational point of view, it causes sensory interpretation, primarily in sight and hearing. And the term in your handout is synesthesia. And you're going to say, well, we heard it was a hallucinogen. In some books, they call it a hallucinogen. A synesthesia is an interpretation of what is really there. So, for example, they call it a psychedelic, but people that take LSD can hear color. Okay? And they can see a sound. So for example, if I'm on LSD and I look at his blue hoodie, I know it's a color, but I will hear that shirt. I will hear the color. I look at his and it's red. It'll sound different. Yours is darker. It'll sound different. So a synesthesia is when. What is he doing? What did you just do? Oh, come on, share it with the class.
There's a song called Blue from 65.
Yeah, and you think it's about that?
There's like blue.
Oh,
The lyrics.
that's it? Well, somebody send it to me. So who does this song?
Eiffel 65 is a real band.
It's a really old band. I'm sorry. Well, I don't know it. I apologize. Jesus, man. You guys are such haters. Don't play it, because then I'll start dancing like this. A hallucinogen is like if I'm there and I'm looking at you two guys and I'm saying, hey, like, is there a fish there? There isn't. See, a hallucination is when I think there's something there that's not there. If I hear something that, like a voice in my head, but it's not really happening. A synesthesia is based on reality. Now, again, this is a very fine point. When you guys are at a party, you can explain that to your colleagues, you know, what the difference is. Some people will say it's LSD, is a hallucinogen. Yes?
Is there any debated pharmacological merit to LSD?
What is the pharmacologic merit?
If there is any.
From a clinical point of view, okay, it would not be used even as a last-ditch attempt for some abnormal psychiatric treatment, but it was tried in the past. So in general terms, it really has no clinical utility, but it is an interesting drug to study to try to understand, you know, schizophrenia, schizoaffective disorder, you know, personality disorders, because you may be hitting some of those receptors. Now, what happens is, so technically, no, it's not clinically useful, but people like it, and it makes them, you know, they're nice. Like if you look at that, like I could be looking at all of you, and I can be hearing wonderful music. Yes.
Is a bad trip from LSD dose related, or is it almost as if like it's kind of like an allergic reaction?
It's not really an allergic reaction, and it might not be dose related. Like, for example, if you do a lot of LSD, you might have a really great trip. Flashbacks are psychedelic experiences that occur later, because to the point we said, it will get into your brain and it may bind to the receptor, it may also alter the receptor. So a flashback, you don't take the drug, but you experience something that kind of triggers it, and then you have that same feeling that you did. So that may be due to some receptor binding that they're not quite sure of. If an individual has a flashback that's beyond 6 months, you may have triggered something psychologically in that particular patient. So it may not be related to the drug, it may be related to the effect that the drug has on your psyche. Okay. And a bad trip is you just feel lousy. Now, this is the truth. Some of these individuals get real panicky because, again, if all of a sudden I'm lecturing and like that red shirt like starts screaming at me or like making noise, then I look at him and it's another noise, I might panic. These are individuals that you talk them down. If it's LSD, you talk them down. If it's PCP, you don't. These individuals, you don't restrain them. Okay? And they're usually very nice people. I mean, they're just having a trip. How many of you guys are into album covers? You know, like vinyl. Who are vinyl aficionados? Vinyl is it's a record. Like tomorrow is Vinyl Day, apparently, and in Princeton they're selling outrageously expensive vinyl records. Well, if you look at some of you, thank you for some of you that admit you know what vinyl is. The album cover, if you look at the 60s and some of the rock bands, the Beatles and stuff, whenever you see like a picture of a musical instrument and like there's these real funky colors coming out, these are individuals who in that genre were on LSD, because when they were playing their instruments, they saw color coming out. So anyway, people are like, oh, interesting, though. We have to visit the Smithsonian Institute. Yeah, that's it.
Themselves on LSD or something?
What?
Beatles themselves on LSD or something?
Of course they were. It's the birth of rock and roll, man. You guys missed out. Yes.
Is the personality change like permanent? Like,
Interesting point. Is the personality change permanent? The answer is, in some individuals, yes. That's why this is a tricky little drug. So in some individuals, the personality alteration can become permanent. Okay. Again, if they dialysis question mark, forget it. acute psychotic reaction, vitamin H. If they have flashbacks, again, to her point, what you may need to do is get them some psychiatric help, because again, past 6 months, you may have altered or triggered something psychiatrically. Gut decontamination is contraindicated because it could precipitate a psychotic reaction. Again, with LSD, just chill. You chill, they chill, everybody chills. Okay, don't go into it unless there's a big problem. Yes, sir?
Why would gut decontamination precipitate this psychosis?
Because if you make them vomit, the violence, if you intubate them and then you lavage them, I mean, they just want to chill. And that can make them really scared and really anxious because it would be like a hostile environment. Okay, yes?
Do you know the connection between LSD and Carrie Mullis?
Who? What?
Carrie Mullis.
No.
He got a Nobel Prize for inventing PCR,
Really?
and he attributed the LSD to helping him develop it.
See? So there is a clinical utility, really. Now, why was that? This is interesting. Why did that happen? Like it allowed him to think?
He had a lot of marijuana, a lot of LSD.
Nice.
I guess he happened to be a smart guy, and he came up with
No,
PCR.
all kidding aside, a lot of these psychoactive drugs, again, like with I'm not advocating any of this, okay? But with marijuana, because you're very relaxing, some hallucinogenic properties, and then you really expand, and then you can look at something, and you can look at and think about stuff, and you can actually see it more clearly, or you just stoned, you know. Okay. Stoned, you know the term stoned, it's a real old term. What is the term that you guys use now? Not that you guys are ever involved in this stuff, but what is the appropriate term?
Baked high.
What?
Are you like baked high?
Baked?
Regular high, yeah.
High, okay, high I guess, yes? You started to say something. Stoned, okay, so stoned is still good. No, the term stoned is still an acceptable term because I'm getting recorded here by everybody. Hey, by the time I get to my, this is Dr. Barchi calling. Okay, so again, these are interesting, and the reason why I tell you this is because it's important for you guys to know you might be in a situation where somebody does something and you need to do some rescue. Okay. Next, we go to date rape drugs. Again, this is, yes?
I have a question. So LSD is not hallucinogen, but only the synesthesia?
Well, you will hear people describe LSD as a hallucinogen. Technically, it is incorrect. It really causes synesthesias, if you really want to be accurate. But if somebody says, oh, LSD is a hallucinogen, it's really not nice to correct them. I mean, a lot of places will call it a hallucinogen.
And the only difference is that synesthesia is based on reality.
Exactly. A synesthesia is based on reality. A hallucinogen or a hallucination is based on nothing. Not tied into any reality. Okay. Date rape drugs. These are sedative hypnotics. And I tell you this because we have treated cases of this, and it's important for you guys to be careful. You see all the terms, easy lay, liquid X. It is not ecstasy. It's a GHB. It is not an amphetamine. You do get an enhanced feeling of touch and sensuality. It does cause sedation, respiratory problems, respiratory depression. This is Rohypnol, roofies. Now, the problem with these drugs is they will cause retrograde amnesia. That's why they are used to commit crime. And I told you, if you are ever in a social environment, the case usually is that you are with an individual or you're with some people, you leave your drink, whatever, it works with water, wine, whatever, and somebody will put something in your drink to commit foul play. and you will kind of remember where you were, and you will kind of remember what it was, but you cannot identify the individual. Ecstasy and MDA, these are mollies. Those are still around. I think they're a little less popular. These are derivatives of amphetamine. They're designer amphetamines. They cause perceptual and behavioral changes, and they will also cause hyperthermia, rhabdo, hyponatremia. These are the drugs that people use during a rave. Like these usually big dance parties in these clubs. These individuals will just move and dance and dance and dance to the point where they actually will get rhabdo, they will drop their sodium, and you can get malignant hyperthermia. Now, they do increase your awareness, because again, they are amphetamines. They will increase your awareness of your surroundings. They will enhance your ability to interact with others, again, because they are derivatives of amphetamines. Yeah.
Do you know what candy flipping is?
What?
Candy flipping.
Candy flipping. No, I do not.
It's when you do MDMA with LSD.
Nice. Wow. Okay, we'll add this to the possible exam questions. No, that's excellent. What is it called? Candy flipping? See, I usually try to keep in touch with my little dealers, but so it's called candy flipping. And that's MDMA plus LSD. Thank you for bringing this up. What will the patient see, feel, hear, or do? Why would you do that? Think it through. Why would you do that? I'm going to wait for it, man. I'm just going to chill. Yes?
The MDMA will enhance the LSD effect.
Right. The MDMA will turbocharge everything upward, and it will enhance the LSD effect. So it will enhance the perception of the sounds and the colors. So, yeah.
Somebody that I know said that if you are, if you're like overdosing on MDMA, you can take an antidepressant, and that will. This person's not educated very well. I don't know if this is true or.
I've not heard that as an antidepressant is going to have CNS depressant and a calming effect, probably to throttle the individual down. So it almost sounds like it's a street kind of. You could probably do just as good with a benzodiazepine to calm down, or ethanol, or something like that. Interesting.
Do you do that in practice, or?
No, no. But you tell your friend to do neither one of those drugs. But this is good. So that tells me that you can be advocates for a smart lifestyle, and you guys get out. Occasionally you do meet non-pharmacy people that clearly are stupid because they don't know. And you might get invited to more parties. You'll be like the medical consultant at a party. Okay. I'm going to blow through these. Okay, guys are harsh. Methamphetamine. Methamphetamine is also called ice or crystal meth. I'm going to go through this quickly because I want to get through the cases, but not to worry. You will be able to successfully answer any question. You will also be able to successfully assist anyone you meet in a social situation because you will know what this does. This is an amphetamine analog. Just know it is a super stimulant. Now, what do you think happens if somebody takes a super stimulant? Well, they will be very wakeful, they'll be very active, they'll breathe very quickly, their cardiac output will go up, their temperature will go up, they will not eat because they just don't care. And euphoria. They will feel great. They will feel very, very happy. Chronic users. These are the individuals you see on TV. Very tragic, meth addict, meth heads. Apparently we have quite a few meth labs in New Jersey. Surprise. So you've got to be on the lookout for that. But the people are addicted, they're violent, they're anxious, they're confused, they're paranoid. If they become psychotic, and again, make a note of this, if somebody becomes psychotic on amphetamine or methamphetamine, the psychosis is a fear psychosis. Remember when we talked about cocaine? It is a controlled psychosis. The individual has a hallucination, they see something, and they become very controlling. With methamphetamine or amphetamine, if they come in and they're having a psychotic event, they'll say, when she is entering into the chart, they'll say, "That is so noisy. Can you please? It hurts my ears. Stop it. You're doing it again. No, I can't. Please, that tap, tap. Stop it. Why are you not looking at me? Why are you laughing? I'm sorry. Do I look weird? Please." Thank you. Why did you call me Dean Barone? My God, am I somebody else? I'm not Dean Barone. Fear. Now I'm on cocaine. See, now she's scared. Okay. If I were on cocaine, I would call it all sorts of stuff. I would say, "Stop with that goddamn computer. Look at me. Look at me. Hey. I'll kill you and I'll kill your fit. Stop that. What are you doing?" Now, of course, she would have been smart enough to restrain me. "Stop that. Don't look at me. What are you laughing at? Hey, I'm talking to you. Hey." See the difference? And again, you think, Barone, this is BS? It is not. Because a lot of times they're psychotic, you're tired, everybody's crazy. Stop that. See, everybody's crazy. That is how you differentiate. Is the treatment going to be really different? No. Because you're dealing with a CNS overdose. I got to watch cardiac, I got to watch hypertension, I got to watch possible stroke, possible seizures. Okay? So the treatment is not going to be that much different. Homicidal stroke. Some of these individuals, when they come in and it'll be like, and then you can also tell they're usually very thin, bad dentition and stuff like that. So, all right, did we cover it all? Ready for cases? Okay. All right. Now we're going to go through these cases. And I will give you key points that will make you super, super Jedi. In Star Wars, like Jedi, when I say you guys are Jedi, is it complimentary? You guys like that, or is that bad? You guys don't want to be Jedi? Who likes Harry Potter? You like Harry Potter. What should I call it? Wizards? Little Hogwarts, my little Hogwarts? I know, it's the school, they're not real things. Yes. What do you like to be called? At one graduation, it was like the Jedi phase. Like, everybody, like, you are Jedi. And then during my graduation speech, the class complained, you did not call us Jedi. So what do you guys want to be called at graduation?
Doctor.
If you get there, you will. If you get there. Actually, I will make a point that you guys are doctors of pharmacy because your degree is conferred by the president at graduation. you will have our own ceremony. Bless you. Oh my God, what was that? See? What am I not? If I start throwing people around, it is. Right? If I said, if you sneeze one more time, man, I'm going to kill you. What am I not? If I'm like, don't sneeze, man, because like you might like knock me down. Okay? Okay? Don't laugh at me. What am I not? LSD? No. I'm going to say, hey, that was a very colorful sneeze. What am I on? Got it. See? Okay. No, what do you want to be called other than doctors? What?
No, it's not about that.
Well, it's not always about you. What do you want to be called? Jedi? No? What do you want to be called? Yeah. Is Jedi? Yeah, you got okay. All right. Well, by the time you guys get to graduation, we'll figure it out. Yes, your question.
Okay, so the other day you said to shut the recordings off because you were telling us about how you should like dose somebody with naloxone, not so that way they wake up and get agitated. Like, remember you were saying that?
Yeah.
So at research day the other day, there were a couple of people that were on their rotations, and they actually said that out loud and said that like a lot of people tell them that in practice and it's public knowledge. So it's not. I don't think it's embarrassing to like say that.
Okay. So give somebody way more than is in the package insert. It's okay.
No, they were saying
It's
that
okay.
like it's public knowledge that you only give them enough so that way they breathe better, but they're not woke enough.
Okay. So I feel better now. Okay. So you can keep the recording. Okay, that's fine. No, that's fine. That's true because a lot of times, just bring you back to Narcan. Every time I try to get out, they pull me back. Who are these people that were telling you that is common knowledge? I want names. Were they in rotation? Good. Probably with faculty that I taught. So, okay. No, it's fine. It's good. It's good. No, I'm not going to trace it. Cases. All right. Now, patient 13, an agitated youth from Jamaica. This is a lot of times how it goes. Customs catches them and they bring them to the emergency department. Pulse of 88, they were anxious, sinus tachycardia, and you suspect the patient denies any ingestion. What do? Does the highlight come out?
Yeah.
Very good. Okay. Although the patient denies any ingestion, the abdominal radiograph shows uniform foreign bodies in her abdomen. Now, if you take a look at the CAT scan, there are little arrows. Oh, sorry, I messed up with it. Yeah, sorry. If you take a look, I'm sorry, I'm spinning on your screen. If you take a look, there are foreign objects in the gut. Can you see? The little arrow is pointing to what looks like a little cork of some sort. Okay, now, the arrows are not going to be in the abdomen. Okay, this is simply for illustrative purposes, so you have to look for the foreign bodies. CAT scan is a good way to do it. So they say they call them body packers or body stuffers, body packers. The diagnosis is based on history or seeing it. Some places do an ultrasound, like what they use in a pregnancy clinic. An abdominal radiograph, which is just an abdominal x-ray, that may be helpful. It may be helpful because you can see it, but again, it's really tough to figure out what is the best way to look at it. A CT is good. I think a CT is probably the best, but it is also expensive. Now, in these individuals, they do give them activated charcoal to try to absorb if there's anything that might potentially break. They do hold bowel irrigation to try to get rid of the contents. Patients with signs of toxicity should be managed with surgical removal. Again, with cocaine, there's a little star there. That is a surgical emergency, since supportive care is often inadequate. So we agree with that, unfortunately. And here they gave go lightly, and everything got pooped out. Now, individuals, in terms of folks that are in this part of the criminal world, they will be picked up at the airport by the handler, who will take them to a safe house where they will poop out the contents. Because obviously the package is the person. And they are carrying lots of money worth of contraband. Okay, so here they talk about body stuffers and body packers. I mean, I'm not going to test you what is worse, a stuffer or a packer. We're going to use the term body packers. Activated charcoal are commonly used to safely purge. What do you not give these individuals? Mineral oil. Contrast images are helpful. And they say estimates from patients tend to be inaccurate. We had one case that they brought in to Bellevue, really scary. The person said that there are, because we looked at the x-ray right away, you start counting, and they said, oh, I swallowed 28, and then we looked and we could only see 26. And as the person was talking, they got more and more agitated because two of them had broken. Again, it was a freak show at that point, because again, it clearly was a cocaine-induced event, and that's where you get to see the surgeons go into action. Okay, yes.
What's the difference between packers and stuffers?
What's that?
The difference between body packers and stuffers?
Well, the difference between, like, a body packer is the term we're going to use for anybody who carries the contraband. Stuffers is what it says in your handout. It's poorly wrapped, small quantity. A body packer is a professional. These are very large quantities. So stuffers are less severe. But again, for the purposes of our lecture, anybody that ingests a condom or any other container to transport drugs illegally, we will call them body packers. That's the term that we'll use. Okay, and it's all explained in the handout. Okay, 35-year-old man with chest pain. 35-year-old man is brought to the emergency department. Chief concern, chest pain. Pain started 8 hours earlier, sudden onset, and occurred about an hour after snorting cocaine. He reports that the pain is similar to prior episodes of chest pain associated with cocaine. This is Darwin's theory. If you get significant chest pain, meaning that you are having ischemic cardiac events after you snort cocaine, what is some clinical advice that you can give this individual? Don't do cocaine. Thank you. You just earned your doctorate degree. Yeah. Okay. And again, these are truths. Like, you keep doing it, and you keep getting chest pain, and it happens every time you do it. So that right there is a clue that this individual snorts cocaine, and it causes coronary artery vasoconstriction, and that's what causes chest pain. And if you take a look at the EKG, and also the CPK is high, and ST segment elevation. So this individual has real signs of a cardiac event. So this patient is having an acute coronary syndrome, likely secondary to coronary artery vasoconstriction. Although he meets the criteria for thrombolytic therapy, it may be prudent to try more conventional means. Because in an individual like this, like if this individual is in his or her 80s and they come in with chest pain, you might suspect that it is coronary occlusion. In young people, it is probably due to coronary artery vasoconstriction. So a thrombolytic has nothing to dissolved. Did I tell you the story about Grandma and Coke? Okay. True story, I became a hero. This is how I established my superb reputation as a clinician. Somebody brought in a grandma, and I evaluated her, and my assessment was that Grandma was doing cocaine. And they said, "Yeah, right, Barone, it's always cocaine." My medical colleagues. And I said, "No, I swear this is cocaine." Because her pupils were dilated. She was agitated. She had high blood pressure, mostly, but no chest pain. I said, "This is cocaine. This looks like cocaine." And I'm like, Grandma's doing cocaine. So when she came down and was more lucid, I talked to her. And I've got that, nice way with grandmas. So I said, "Grandma," I said, "What did you do?" "Well," this was going to tell you. One day my grandkids were visiting. And I found them snorting cocaine. And I said, "What are you boys doing?" And they said, "Oh, Gramps, we're doing cocaine." She said, "What? Isn't that a bad? You shouldn't be doing cocaine." And what did they ask her? "You want to try some, Grandma?" And Grandma tried it. Now, you're old, you're creaky, you feel tired. How do you think Grandma's going to feel when she does that first hit of cocaine? She smiled like you. She liked you. She loved it. She loved it. So she started doing cocaine with her grandkids. The visits increased. And a true story. I mean, you can't make this crap up. So, and of course, the grandkids came. So I, again, being also good with people of all ages, I said, "Come on, guys, what's going on?" We do coke with Grandma. She likes it. Okay, we're doing it for her. I said, "Oh, of course you did." So I said, "Look," I said, "We're cool. We're not telling anybody. Just cut the dose a little bit." Grandma liked cocaine. She loved it. It made her feel good. It made her feel sharp. It gave her energy. But her cardiovascular status was not able to handle that much cocaine that they were giving her. So, my advice, or after that, one of the things that the jokes I made was that the family that snorts together stays together. There you go. Sorry, that went over very poorly. So anyway, what they talk about here, there's a couple of points. You can get pro-arrhythmic effects. Cocaine users are at increased risk for stroke and cerebrovascular events. Cocaine may induce coronary vasoconstriction, which results in ischemia and high blood pressure. We talked about hyperthermia because of all of their activity. Agitation, I think they gave a little bit of a benzo. So what happens is, there's another thing. If the pressure is high, some individuals will give a beta blocker. Just know that we recommend against beta blockade, because if you have beta blockade, you will have unopposed alpha, and that might cause further vasoconstriction. Remember that. And again, this individual had rhabdomyolysis. I apologize, we only have 10 minutes, so we're just going to really go through these. Clinical pearls, thrombolytics should be used cautiously. Benzodiazepines are helpful because they'll calm the patient down. If you take care of the CNS effects, you might help the cardiovascular effects, and you avoid beta blockade. Next case, a 16-year-old boy with bizarre behavior. He comes home and he's not himself. He goes out with his friends and he's not himself. And they say that he was combative and agitated. He was anxious and fearful. And they say, when he tested positive for cannabinoids, what they say it was probably due to a hallucinogen. Now, honestly, I cannot say what they thought of here, I mean, other than he was anxious and fearful, that they automatically said this was a hallucinogen. Okay, they talk about agitation, but again, we'll use this for the purposes of talking about a hallucinogen, and they call it LSD. To your point, it's not really, but for the purposes, just know that it is a synesthetic agent. They call it a psychedelic. These are blotter acid. This is little blotter paper. Not that you guys use blotter paper, but it's like a felt paper. And who is that character? Felix the cat. Very good. Very good. Felix the cat. They say LSD, like other hallucinogens, okay, we'll spot them, that can cause alterations in perception and awareness. Notice where the arrow is, they call it pareidolia. Don't worry about that, but it's synesthesia, blending sensory input, seeing that colors can be heard and sounds can be visualized. Flashbacks, you can have, again, here they say if you have psychotic episodes, flashbacks are due to pre-existing psychiatric disease. If you go further down, you talk down these patients. And here they put the patient in a quiet room and they gave them a little bit of benzodiazepine to calm them down. So again, they say that LSD is a potent and long-acting hallucinogen. Let's not argue that. LSD, the patient may be alert but also anxious. And they say they are fearful, so they may be safely and effectively treated by decreasing sensory input. These individuals, you can calm them down, you can talk them down, they just want to chill. As opposed to a PCP, which you just leave them alone in a room, close the lights, make sure they are restrained. Okay, next case. I think this is the last one. Yes. A 16-year-old girl has been dipping. A 16-year-old girl is found unconscious in the street. Upon arriving in the emergency department, she is awake but intermittently agitated. Okay? She admits to dipping. Dipping is when you, her pulse is 96, which is high. She has vertical and horizontal nystagmus. Okay? Again, these are from real cases that emergency medicine people send in. So vertical and horizontal nystagmus is key in this diagnosis. Now, of course, you do the labs and it's positive for PCP and cannabinoids. So, what is dipping? Dipping is one of a number of terms for smoking tobacco or marijuana after dipping them in embalming fluid. Okay, which is the street name for phencyclidine and formalin. Okay, but again, if somebody's dipping, it can just be phencyclidine, PCP. PCP, tobacco or marijuana cigarettes. The term is dipping. It is a dissociative anesthetic. Know that. No ketamine is related. And the clinical effects are variable. A state of dissociation from the environment, disordered thinking, hostility or other inappropriate behavior. Higher doses may produce a comatose appearance like I demonstrated earlier. And it can produce psychosis that is hard to distinguish from schizophrenia. Yes?
So I used to volunteer at RWJ emergency department.
Okay.
There was a patient who came in who was supposedly on PCP. I mean, he was restraining and everything, but I overheard them talking, do we give him ketamine to sedate him? Is that something that they would usually do?
That's an interesting point. Sometimes you would use a drug like ketamine to calm the patient down, but I would not do that. That is very aggressive. There are some. I mean, that's kind of like out there as a fringe treatment because, for example, there is a psychiatrist friend of mine in Princeton who treats ADD with ketamine. And apparently there might be some relationship between the ADD, or it's the ADHD disorder and trying to alter, some of the mental wiring. But the ketamine is a little out there, because here it says the effects are similar to ketamine. But I'll look into that, because that's almost as sort of aggressive as putting somebody under anesthesia and giving them large quantities of naloxone to clean their receptors when they're going through heroin withdrawal. But I'll look into that. Hostility or other inappropriate behavior, we talked about that. We talked about nystagmus. IV benzos, to calm them down. Antipsychotics, they have haloperidol. And she was placed in a quiet room for observation. Within 30 minutes, she was much more calm. Within 6 hours, she was no longer exhibiting signs of intoxication. So here, clinical pearls, drug users may be unaware that they have ingested PCP. We have all of the street terms, just know the ones we talked about. And what they say is they like to give benzodiazepines for sedation. You can also give haloperidol or Haldol for sedation. Okay, you want to know drug abuse experts? Be well, be safe. I won't be here next week. I think you're doing some more cases. And then, like I said, I will have a bulk of the exam. It will be very straightforward. If I highlight something, if it's important to me, should be important to you. If I circle it, if there's an arrow, if there's an asterisk, it means it's important. Be safe. Have a great weekend, guys. Oh, I love the color of the sound of clapping. Get it? Thanks. Good. I don't know. What classes? Are you guys in any of the what is next year? We'll do a seminar.
I will.